Hello everyone, Dr. Prabhakar Koregol from Fortis Hospital and Bangalore Super Speciality Clinic. In the light of recent happenings, lots of you are very much anxious about getting your heart tested. But somehow the kind of testing you do or what you feel is necessary is not exactly scientifically chosen. Many of my patients and their relative I see getting something like an ECG, and once the ECG is told to be normal, thinking that their heart is normal. They are not the same. ECG being normal, echo being normal, not always means the heart is normal. So the first thing is, if you decide to test, it's better to consult your doctor. Need not necessarily be a cardiologist. You can consult your general practitioner or physician and look what are the appropriate tests for you. And also, once you are done the test, it's very, very important that these tests are reviewed by a doctor. Many times we end up seeing the patients getting tests done, but they are not reviewed at all by a medical professional, and later on when they come with some major emergency, I will be saying, look, you have already had an abnormality in the test that was done 2 years back. How come you did not take any actions? So it's always important to get your reports reviewed by a qualified doctor. As a thumb rule, the basic investigation for the heart involves ECG, echocardiogram, and treadmill tests. Only for the people who cannot do a treadmill, or in whom the treadmill is contraindicated, or the treadmill reports come abnormal, would require additional investigations like angiogram, CT coronary angiogram, or certain other tests like stress thallium or the MR cardiac. And depending upon your risk factors, depending upon the symptoms, there may be some additional tests also required, which your doctor will be able to test. And apart from this heart test per se, the checking for your cholesterol, creatinine, and the sugar levels is also equally important in terms of the risk factors. But at the end of the day, the benefits will come by you taking the preventive and therapeutic actions based on your assessed risk factors and the reports.